Test for glenohumeral shoulder joint instability. The first test is a sulcus sign test. So as you can see, the therapist will position his hand on the posterior and anterior aspect of the shoulder, and will also have a firm grip on the humerus of the patient. And all you can see he's doing is testing for multidirectional instability of the glenohumeral joint. So with the patient in seated, or it can be done in standing, with the arm relaxed, the humerus is pulled downwards as inferior traction is applied. If the patient was to have a positive test, so a sign of instability, there would be a dimpling effect below the acromion, the patient would be experiencing an instability, so there'd be kind of a dimple in the area. The next test is the apprehension test. This test tests for the anterior capsular inferior glenohumeral ligament and glenoid labrum laxity. So the patient will go into a supine lying position, or it can be done in sitting, but it's better to be done in a supine lying position, with the shoulder abducted to 90 degrees and with a with an elbow flexion of 90 degrees as well. The shoulder is then passively externally rotated by the therapist, so with a positioning on the hand and the posterior aspect of the elbow for support. The test is then passively moved into an external rotation. If there was a positive test here, the patient would more or less feel the shoulder kind of re-dislocating, so actually going into a dislocation if they'd had a previous dislocation. Also, the therapist might see that the patient doesn't want to actually move into that position, and they're actually quite apprehensive, hence the name of the test. And as well, resistance may be felt or movement of the humeral head if there is extreme laxity in extreme cases. And the final test is the relocation test. Very similar to the apprehension test. So this actually again tests for a more anterior instability of the glenohumeral joint. So once again, the patient is in supine lying, with the shoulder again abducted into 90 degrees and the elbow flexed into 90 degrees. So the same start position. The shoulder is first externally rotated by the therapist, and then a measure is taken to see the end of range of external rotation and the apprehension level as well. So it's two tests made into one. Following this, the therapist then applies a posterior force over the humeral head, so pushing down posteriorly during the external rotation. So as it's taken into an external rotation, if there was to be a positive test, there'd be an increase in external rotation, and prior to the apprehension, so the first time without any pressure, there wouldn't be the same level of external rotation. So in a shoulder with high levels of instability, there'd be a lot more external rotation the second time through with the posterior force applied. That concludes the 3 tests for the instability of the glenohumeral joint.